Hi, I'm Dr. Rob Cushman, the Acting Medical Officer of Health for the Renfrew County and District Health Unit. And I just want to give you a little briefing today, now that it's Friday. We've had a good February. We've had very few cases, roughly one a day, and oftentimes less. We've now vaccinated all the residents in long-term care who wanted to be vaccinated, and there's more vaccines on the horizon to give them a second shot, but also to vaccinate staff and family members who are providing essential care. But more important, or at least for you folks out in the general community, we've been rewarded for our good behavior. We're now in the green zone. We are one of 3 areas in Ontario to go there first, and we're entering our second weekend. So you can go to a restaurant, you can go to a bar, there's more business activity. This is great. However, as usual, there's another side. And as I've said before, this can turn on a dime. And I do have 1 or 2 issues to address with you that give me some concern. First of all, is we've seen a lot of activity in the Barry's Bay area, much more than usual. And in fact, they're giving us more than a third of our cases since January 1st, which is really very surprising, given that they're only 12% of the population. But there's another issue that's bothering me even more. And when I've looked at our cases of recent, that's the past 2 weeks, and this was even before the lockdown was over, what I'm seeing is that there are a number of contacts. There are too many contacts. That means for every case, we are actually looking to phoning up and talking to between 5 and 20 people. And this doesn't make sense. We've heard that with the lifting of the lockdown, you can go to work, you can do some shopping, you can get outside a little more than usual. But we've said all along that this does not mean socializing. This does not mean it's party time. We actually had an example of a bonfire party. Well, I don't know how distant people were, and I don't know how many masks they were wearing. But I really question that kind of activity if it's not done carefully. So as I said, we're seeing too many contacts. When we have to pursue 15 or 20 people after we get a case, that tells you something. The so-called bubble, or whoever you're working with in your own household, whoever you're working with at work, where you do maintain precautions, we are not paying as much attention to this. And if you look at what's happening in Ontario, we are now seeing variants. That's what's concerning. And we've heard that these variants are super infectious. Well, guess what? If you're working in a larger crowd or playing in a larger crowd, other than your household, other than strict precautions at work, this is how this virus travels. This is how this virus will get into Renfrew County, and this is how it will spread like a brush fire. So we are in green. We want to keep it that way. Toronto and Peel are very concerned about a third wave with the variant, and we, as their neighbors, and being not far away, and because the virus can travel quickly, have to be equally concerned. So what I want to say to you today is please, 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 masking, distancing, but most important, limit your social circle. It should be to those in your household or those in your family who aren't in your household who need help, an isolated grandmother, for example, kids at school for sure, but the schools are doing a good job. It's the playgrounds and the lunchrooms that are the problem. Also at work, pay a lot of attention to this. We've been impressed by workplaces, how they serve their customers, but we've been concerned about what happens during social time, lunchtime, when workers congregate and have a lunch together. So again, we have to be extremely careful and limit the number of people you socialize with. And this will help us get through this winter. We're nearing the end of February. We see more vaccines on site for those most at risk. Once we get through this winter, we should have an ample supply of vaccines late in the spring. But in the meantime, in that it's cold and it's still winter, we're indoors, you have to limit your social circle, and you have to pay vigilant attention to masking, distancing, hand hygiene. But as I said, overall, the number of people you associate with, because the virus loves to associate with people. That's how it gets into our community, that's how it spreads, and that's how it does its damage. So again, keep our economy open, and the best way to do that is to heed the rules, but pay particular attention to the number of people you associate with. Less is best. Thank you.